Children can grow up in environments with parents that don't support them in a way that is optimal for the child. Either the child has an interest that is considered special or outside the capabilities of what the parents can provide, or there's another reason. And therefore, that child doesn't get that specific level of support, or is just not being understood. Because, for example, you have parents who have been librarians all their lives, or have worked in biology all their lives, and their child is very much interested in computers or video games or something like that. Or small animals, whatever. And is not being supported to pursue those things. Instead, is being put on a path where that child has to conform to the expectations of that parent from a very early age, but doesn't want to. I think it's fair to say that if people are forced to do something that they don't want to do, and there's no way for them to get away from that, because once again, as a 5-year-old, you can't get away from your parents because you're a 5-year-old, you're going to check out. You're not going to be challenged, not in the way that is optimal for you. And what happens then is that kid starts acting out, starts becoming rebellious or angry or sad or start throwing tantrums and all those sort of things. And it feels like parents don't recognize that dynamic going on and instead get very annoyed or even angry and start lashing out at that child and want that child to stop. Why can't you behave normal? Why can't you just be like any other child? Something along those lines. And then when that child gets out of control, what they do is they bring that child to a professional, to a psychologist or psychiatrist, or maybe even just a regular doctor, right? If they didn't go down that path yet. And then that label comes. Then that label autism comes. And then that kid is marked for life. And that kid will get medicated. And that's where I draw a line. I don't understand that. So this is a feeling I'm having. I'm not sure if the feeling is fair, but this is right now the way I'm looking at this. And this, obviously, it doesn't go for most cases. I get that. I 100% recognize that there's definitely cases where autism is a very clear thing and medication might be the best option for going forward. I fully 100% recognize that. But I don't think that is the status quo. So when you hear this, what are the thoughts that are coming up in your mind?
A number of them. It's a scenario that I'm very familiar with. So in my training, you have to pick paths and who you want to work with. So I went to the anxiety specifically with adults, and I have other friends who chose to work with children. You are rarely working with children. You're almost always working with the parents, right? So you work with the children and help them understand and process their emotions and talk. But in order for that child to actually make any progress, you have to work within the system that they're operating in, and that's the parents. So an immature parent, an immature emotional parent, will look at their child as an extension of themselves and will need that child to behave in very specific ways because it is a reflection of the adult, and will not see the child as an individual that the parent is in service to. So that right there is one of the biggest small t traumas that almost all of us have experienced. It's endemic. And so then the child, in order to be able to continue to connect with the parent, needs to find a way to they either ingratiate themselves with the parent, and so they forget the things that they really wanted and what were natural to them, or they do the other and they try to get that negative attention from the parent, and they act out. That is, you only have two ways as a child. The third is really just shutting down completely, and that is just I've tried everything and nothing works, and there's the shutdown. Usually it's one of the other two. You ingratiate or you lash out. That is exactly how children operate. So with most professionals, they are trained to recognize that the problem is not inherent to the child, that it is within the system that they're operating in. The exception there is when the behavior is, again, a safety concern. Are they hitting others? Are they hurting themselves? Are there problems there that we, so it's not just sort of opposition, it's whether or not they're physically harming. Um, then if they're going to get a label, there should be extensive testing. So for instance, for Massimo to get the autism label, which interestingly enough, as a 20-year-old, he actually doesn't meet criteria. He only meets criteria based on his childhood expression. He's at a place in his life where, if you look at the DSM definition, he doesn't meet any of the clinical criteria anymore. But as a child, he most certainly did. And so the diagnosis there was extensive, the testing that we went through in order for that. So for it to only be based on a parent's word or specific child behavior, I think happens either you're going to somebody who is not an expert and they are somehow incentivized to give a label. So that could be somebody who is at a lower level in their training. So master's level is not necessarily able to do the diagnosis. Or you're going to somebody who doesn't specialize in that particular behavior. I know that people have gotten the label of autism somewhat, I'm going to say, non-professionally. They got it from a teacher. They got it from a medical doctor who was, a general practitioner. That, I would say, is separate from someone who has gone through the rigor with a specialist to actually pull apart what the symptoms are and is actually focused on appropriate treatment. I think there is a whole class of practitioners who are operating outside of their area of expertise because they are focused on the parent and not necessarily focused on the child. I hope that is fewer than I have witnessed. But it is expensive and difficult to go to experts. It is not easy for every parent, and they don't have access. And so if their child is acting out, they're going to go to the person that they have resource and access to. And it would be my hope that those people would not give a label that they are not trained and capable of giving. But I've heard a lot of people say, well, I was told I was bipolar. Based on what? I've looked at your history. Like, who, what? It was just because they were going through a particularly angry period and acting out, and it was a more comfortable label to say bipolar than it was to say you're angry and you don't have a way of expressing it that makes me comfortable. And so I do think that does happen, but it doesn't happen in the system as it's set up. It happens when people are operating outside of a true educated diagnostic system. And I feel the same way about the medication. If you are getting medication for a label that you are not capable of giving, you're not going to give the appropriate treatment. And so, my son has never been medicated. What would we medicate him for? Um, again, like there isn't a specific treatment for the way that his brain works that a medication would be appropriate for. And we gave him some melatonin to help him sleep when he was challenged with that. But aside from that as a specific symptom, I'm not sure what we would have done to medicate. And so if the concern is I need to change the child's behavior and I'm unwilling to engage the child directly and I'm unwilling to change the context in which they're operating, then I can see that some practitioners would choose to use medication. The only time that I could think that is valid is when there are safety concerns.